Hi, you've joined the conference. Can you hear us okay?
Hello 啊，妹妹主人你好啊，想睇下你聽得我哋清唔清楚
Yeah, OK 啊，聽得清楚。
Great. So we scheduled this call so that we can check on Mui Mui's progress. So last time I saw her at the clinic, she was feeling unwell. Her appetite was poor. She was only eating about half as much as normal, and all her lymph nodes were enlarged. And then we started her on chemotherapy. So I would like to check on how she's travelling with all of those problems. How's her appetite? What's happening to the lymph nodes? And how does she seem to be feeling?
嗱，妹妹主人，我哋上次見面嘅時候咧，妹妹咧就唔係太舒服啦，咁佢個食嘢胃口就唔係太好啦，亦都佢個淋巴咧亦都係有脹大咗嘅，咁跟住我哋就開始咗個化療啦。想睇翻咧，佢而家個情況係點樣？佢食嘢胃口 O 唔 OK？你覺得佢整體嘅狀況嚟講咧，你覺得係點樣？
整體狀況非常之好啊！佢食嘢嗰度真係食得翻晒啲嘢啦，咁我亦都有自己即係煮啲雞柳啊咁樣俾佢食，咁就大便啊嗰啲都 OK 嘅，咁同埋就好精靈啦。
So Mumu Sana said like she basically the dog is doing very well at home, is eating well, so is willing to eat some chicken fillet. It's very bright at home, no diarrhea at all, doing fine at home.
That's great to hear. Now, what about the lymph nodes? So when I saw her, she had some large lymph nodes here at the front of her neck, just behind her jaw, and here at the back of her neck near the shoulders, and also on the back legs. And each of her lymph nodes was about this big. What's happened to those lymph nodes since then?
嗱，咁我哋上次見面嘅時候咧，妹妹嘅淋巴咧係有脹大咗嘅情況啦。咁基本上咧喺我哋個頸仔後面啦，我哋個胳肋底位啦，咁同埋我哋個後腳位啦，咁大概有咁大個度嘅。咁想睇翻而家嗰個淋巴嘅情況係點啊？你摸唔摸到？
你係講緊呢啲位啊？摸落去我就摸唔到嘅，同埋後腳嘅嗰啲位都摸唔到嘅。
So basically, the Anna said like she cannot feel the lymph node right here, and then on the back leg as well, she cannot feel it anymore.
That's great. So that's telling me that she's in a complete remission. So all of her lymph nodes have disappeared. And what we expect when dogs go into remission is that all of the signs of disease go. So her appetite will improve, which is what's happened, and all of the other signs related to the lymphoma should disappear, which it seems that they already have. This is really good news. Dogs who get a complete remission, especially dogs who get an early complete remission, tend to do much better than dogs that get a late remission or dogs that get an incomplete remission. So my expectation is that she will do very well longer term. 咁咧嗱，醫生就話啦，基本上咧，我哋而家見到嘅有嘅病徵咧，咁睇嚟都有一個整體嘅舒緩嘅情況啦。咁我哋通常呢啲嘅情況，我哋都係見到佢有一個癌症嘅整體病徵舒緩啦。咁我哋基本上而家身體裏面咧，其實咧個癌症上咧個病徵咧就已經見唔到啦。例如話我哋嘅淋巴啦冇再脹大嘅情況啦，我哋見到有影響到嘅病徵啦，亦都冇再出現，即係例如話我哋食嘢胃口亦都冇越差個情況啦，食嘢胃口去翻正常啦。咁係非常之好嘅。通常咧，如果狗仔咁早我哋有一個完全性嘅癌症舒緩嘅話咧，係比起我哋有一個唔完全有癌症舒緩嘅情況，或者一個好遲之後先有呢一個情況出現咧，係比較良好啲嘅。 Now there's one other thing that I wanted to check with you. When I last saw her at the clinic, she was quite pale and her capillary refill time was slow and she was mildly anemic. So I would like you to do the capillary refill time check, and I'd like to see that happen. So can you just lift her lip up and put your finger on her gums to make the pink area go white, and then lift your finger off. And I just want to see that white area change back to pink again.
嗱，我哋咧上一次喺診所見妹妹嘅時候咧，咁佢個微血管咧回沖嘅時間咧就相對嚟講係比較慢啲嘅，咁同埋亦都有出現貧血嗰個情況啦。咁我哋想試下咧教你咧去幫我哋做呢一樣嘢，咁然之後等醫生而家可以即時去睇一睇佢嘅情況。嗱，基本上你掀起佢嗰個口仔嗰個皮嗰個皮仔啦，拎起啦，咁你會見到有粉紅色嘅位置嘅，咁就幫我哋撳落去，撳到佢變咗白色，跟住然之後放手。我哋要睇翻佢嗰個緩衝嘅時間咧係有幾快嘅。
Hey, 妹妹。
Hi， 妹妹。
Okay, do that again. do it a few times.
係做多幾次，幫我哋做多幾次啊！唔該。
Great, thank you.
係啦，唔該晒你。係啦，醫生都睇得清楚嘅。
So what I'm seeing is that she's quite pink. Her capillary refill time is normal now. So my guess is that her anemia is not getting worse and she's feeling less unwell, which fits with what you've told me.
嗱，咁基本上咧，我哋而家睇翻啦，見到佢咧其實都好粉紅啦，佢嗰個牙肉嘅顏色。咁我哋見到佢嗰個微血管嗰個回衝嘅時間咧，亦都睇嚟係正常嘅。咁即係話俾醫生聽咧，基本上佢個貧血嘅情況應該得以去舒緩㗎啦。咁整體嚟講，我哋見到佢個情況咧係有一個進展喺度嘅。
Now, do you have any questions about her situation or what's going on or what we're going to be doing with Mui Mui?
醫生想睇翻啦，咁你會唔會有其他嘅問題想問佢，或者你會唔會想知多少少關於之後嘅情況啊，或者有啲乜嘢地方係唔清晰嘅？
仲想有樣嘢問就係關於佢啲補充品嘅嗰啲會唔會有啲咩需要咁樣
So I want to ask, like, is there any supplement needed for Mui Mui at the moment?
It's a really good question and it's a very common question. So I don't generally recommend supplements. What's really important is that she eats and that she eats well and enough to maintain or increase her body weight. She was a bit underweight when I last saw her, so I would like her to be eating enough to gain weight. And to do that, we want her to be eating things that she likes and if possible for those to be balanced dog foods. So if she finishes everything she eats, you can just give her more. There's no limit to how much she can eat at the moment. She's got a lot of catching up to do.
嗱，醫生就話啦，基本上咧其實就冇話一個好大嘅建議，就係講關於任何嘅補充劑啦。調翻轉反而，因為我哋上次見妹妹嘅時候咧，都覺得咧佢其實係有比較即係個體重過輕嘅情況嘅。咁我哋希望佢要食嘢啦。首先我哋要見到佢食得好啦，同埋佢肯食得多啦，係啦。咁佢暫時嚟講咧，我哋冇任何即係限制住話佢食幾多嘢嘅。嗱，如果佢食完你俾晒佢，即係俾佢食嘅嘢啦，咁可能隔一陣咧你可以再補多少少俾佢都唔怕嘅，係啦。咁當然啦，如果佢中意食係最好嘅。如果有啲即係佢中意食之餘，佢仲可以再增加個份量咧，就會更好啦。咁因為佢唔需要擔心話佢會唔會話有過肥嘅情況嘅，因為而家暫時嚟講，醫生見到佢有過輕嘅情況，佢需要食多啲嘢去慢慢增加翻個體重嘅。
It's great that she's feeling well and that she's regained her appetite. But we're entering that period from day 4 to day 7 where it is possible for her to get gastrointestinal side effects. So this is the time where she might get diarrhea, which is quite a common side effect, or loss of appetite or vomiting. So if you see any of those, please contact the clinic when it happens.
嗱，基本上咧，醫生就話，如果我哋而家見到佢嘅情況咁良好咧，係非常之開心嘅一件事嚟嘅。咁但係通常咧，我哋狗仔啦，如果開始緊化療嘅時候啦，通常去到第4到第7日咧，係最常見，我哋會見到有病徵或者有唔舒服、有副作用嘅情況。例如話佢可能會有一啲嘅腸胃不適啦，佢可能會有屙嘔啊，或者佢可能會冇胃口食嘢啊，唔精神嘅。如果見到任何呢啲嘅病徵咧，咁緊嘅要即刻聯絡診所啦。
All right. Do you have any other questions?
係想問翻咧，妹妹主任你有冇其他嘅問題想問？
都冇啦。
All right, so we will see you back at the clinic a week from today. We'll take a blood test from Mui Mui then to check her white blood cell count, and then she's due for her next chemotherapy in about 10 days from now.
嗱，咁我哋大概例如由今日起啦，1個星期到啦，咁我哋就翻去診所見面啦。咁到時我哋咧有機會可能要再幫佢做個驗血啦。咁然之後下一次嘅化療咧就係大概今日起嘅咧第10日到，咁我哋就要做下一次嘅化療嘅，係啦。
OK，唔該晒你哋，唔該晒。